PCOS, a silent disease that can steal your dream of motherhood. Have you noticed hair growing on your face, irregular periods, and still brushed it off as normal? Do you know that a small, silent disorder might be stopping you from becoming a mother without you even realizing it? Welcome to my channel. You're watching Health Bridge Europe. In this video, we'll talk about a condition that slowly destroys a woman's hormones, her menstrual cycle, and her ability to become a mother. And often goes unnoticed for years. Every month, a new hope, and every time the same heartbreak. Your tests are normal, but you have PCOS. PCOS, Polycystic Ovary Syndrome, a name that may sound ordinary when you first hear it. But when it becomes a part of your life, it can take everything from you, especially your dream of becoming a mother. Part 1. What is PCOS? PCOS is essentially a hormonal disorder where testosterone, male hormone, increases in a woman's body. Insulin resistance worsens. Eggs don't develop or release regularly. As a result, periods become irregular. Hair starts growing on the face. Weight gain becomes rapid. And most importantly, getting pregnant becomes difficult. Part 2. How does PCOS prevent pregnancy? 1. Ovulation stops. In PCOS, eggs either don't mature or fail to release. 2. Egg quality declines. Even if the egg forms, it's often too weak to be fertilized. 3. Hormonal imbalance blocks implantation. Even if fertilization occurs, low progesterone levels can cause early miscarriage. 4. Insulin resistance poisons the uterus. The uterine environment becomes toxic for implantation. Dr. Anja Steiner, Germany, says, PCOS is not just a hormonal issue. It completely dysregulates the reproductive system. If not understood properly, it can shut down a woman's most fundamental desire, motherhood. Part 3. Hidden symptoms of PCOS. Often overlooked. Many women have no idea they have PCOS because their periods are just a little late. They get occasional acne. Fatigue or weight gain is dismissed as routine, but in reality, these are all the silent screams your body is giving you. Symptoms that often go ignored. Monthly periods, but always delayed. Thick hair on the face, chin, or back. Unexplained weight gain, constant fatigue. Extreme emotional swings, darkened skin patches, acanthosis nigricans. Part 4. How many women are affected globally? According to European research, 1 in every 10 women suffers from PCOS, but only 30% are even aware. Dr. Elena Lizarraga, Spain, says, PCOS is the fastest growing reproductive disorder today, especially among young women, where it's often dismissed as just a cosmetic issue. Part 5. How is PCOS diagnosed? To diagnose PCOS, doctors look for any two of these three. 1. Irregular periods. 2. Excess androgens, facial hair, acne, etc. 3. Polycystic ovaries, small cysts visible on ultrasound. But here's the problem. Most doctors focus only on the ultrasound and ignore the rest. This leads to misdiagnosis or years of untreated symptoms. Part 6. What happens if PCOS is left untreated? Infertility, repeated miscarriages, high blood pressure, depression, and anxiety, uterine lining cancer. Part 7. Treatment of PCOS, the road to hope 1. Lifestyle changes, the first and most important step. 30 minutes of walking daily. Cut down on sugar, bread, and rice. Get enough sleep. Practice meditation and deep breathing. 2. Low glycemic diet. Focus on vegetables, lean protein, avoid artificial sweeteners. 3. Supplements inositol for egg quality. Vitamin D, deficient in 70% of PCOS women. Omega-3, zinc, magnesium, checkmark 4. Medications metformin for insulin resistance, Clomiphene for ovulation. Letrozole, a newer and more checkmark effective option. 5. Advanced treatments IVF with PCOS-specific protocols. Ovarian drilling, only when necessary. Hormonal therapy under expert supervision. Part 8. Can you become a mother with PCOS? Yes, but only if you don't waste time, you don't ignore symptoms, you stop saying it's okay when your period is late, and you stop thinking of PCOS as just a facial hair problem. Dr. Sabine Reinhold, Austria, says, PCOS isn't the end of a woman. If diagnosed on time and the right lifestyle is followed, 80% of women can conceive naturally. Part 9. 5 questions to ask yourself. 1. Are my periods regular every month? 2. Is there unusual hair growth on my face or body? 3. Do I often feel tired, sad, or irritable? 4. Am I struggling to lose weight? 5. Do I feel hopeless every time I fail to conceive? If the answer is yes to 3 or more, please consult a specialist immediately. Conclusion. A promise. A hope. PCOS can't stop your life unless you let it. Always remember, becoming a mother isn't just about the body. It's a journey of willpower, knowledge, and healing. Today, you have the knowledge that millions of women don't. So rise, take charge of your body, and claim everything you deserve. If this video touched your heart, please share it with a sister, daughter, or friend who may be silently suffering without knowing she has PCOS. Because one sentence, one video, can fill someone's empty arms.